And welcome back to the show. XL Wellness was created to bring quality community wellness and professional development services to people, especially those who are Black, Indigenous, and people of color, and the LGBTQIA community in New York City through an initiative People First model. And joining us to share more, we've got the founder of XL Wellness and Marielle Montero. And thank you so much for being with us, Marielle.
Thank you again, Darren. Thank you
Thank
for
you.
having me.
And so you are grasping entrepreneurship and mental health and taking it to the next level. Talk to me about mental health because it's a passion of yours. And why mental health?
Well, I ended up breaking into the mental health sector almost by mistake. I am a person with lived experience who had been diagnosed back in college. I was diagnosed with anxiety, depression, and PTSD. So my story is one of learning how to basically find the work styles, the work to do in the community, and the ways of working with myself and also with just my colleagues and my community all around me on how to be mental health conscious as I go about my professional journey because there was a lot that I wanted to accomplish at that age, but I just lacked that foundation. If you have peace within yourself, is something that I've learned, then you can accomplish so much more than if you're just on go, go, go and ignoring things as they happen. So, one of my biggest lessons with bringing XL Wellness to this community is that there is no access to mental health care. There is a huge and dire need in our community for not only mental health care but also for institutions, schools, workplaces, etc., that support our mental health, that support us in our growth in that area. So this is the reason why I'm so passionate about mental health. I am a person who has dealt with it all from A to Z, and I'm here to help the community to learn all the different tools and the things that I learned to get me to where I am today.
Help us out a little bit in this area. So many people deal with the issue of anxiety, right? We're talking about a group of people who are coming out of COVID, right? We know that anxiety sometimes is at an all-time high. Anxiety and panic attacks, those are things that are common with mental health. Help us through this. How do you deal?
When I was starting out in the pandemic, I was a career coach. And I eventually transitioned over to the mental health space because the need became so dire during that time that people literally had no outlets. Counselors were fully booked. You had to wait months to get to see a therapist, sometimes even for the first screening or the pre evaluation. So this is a community issue that came about, and eventually, what has happened is that people have learned that through community mental health, which is a lot of the work that XL Wellness does, and individual therapy or group therapy or family therapy, couples therapy, that a lot of people have been able to see themselves moving forward in ways that they did not expect to because they didn't have those supports in place before. So I've seen a lot of people grow, but I've also known that the gap is huge and that a lot of people who need the services, 50% in my community, for example, don't even have access to healthcare. So how do we begin to access a therapist when we don't even have access to a general practitioner, when we're crowding emergency rooms? So it is a huge crisis, and also with the homelessness to for the community to take on.
Yeah.
So we are fighting that fight every day in many different ways.
So somebody's out there and they're dealing with mental health and they're really struggling right now. You talk about having access, and it's not always the ability to have access to talk about this. What do you recommend for somebody who's struggling?
One of my number one recommendations is to know what hotlines are in your area. For New York City, we have NYC Well, which has a wealth of resources. If you call them, they're able to direct you to anywhere in New York City, in proximity of where you live, and they can connect you to resources. We also have 988, which is a location enabled hotline that you can call if you're in a mental health emergency, and they will send either the police or a mobile crisis response team. So that's something for the community to know, and also the National Suicide Hotline. And I say those resources just as first steps, right? We have mental health first aid in the community through XL Wellness and also through other organizations. And workplace policies are one big area where all of us can take a little bit of that load, where we can return to our workplaces and talk about normalizing self care days, mental health days, writing those into people's employment plans, and making sure that people are advocated for at every level because we know so many people in the community who play a role in many different areas of their community. So we need to make sure that all those different communities that they serve are also serving them.
Yeah. For yourself, you've done this and you're now an expert in the field, right? Talking to people and helping people through this. But you based it on life experiences, right? That also
Absolutely.
helped you to really get to where you are. Share with us a little bit about the journey that you've had from, you know, the patient to the therapist.
I'll say this. There's a statistic that we teach a lot in mental health first aid that usually it takes people 11 years from the onset of symptoms to reaching somebody who can actually help them with care. For me, that was not the case. It was not a full 11 years. But I will say that it took a full 11 years for me to realize that my mental health care was going to have to be a part of my life forever. And I think that that's something that a lot of people who are dealing with symptoms or think that they are having a mental health challenge really have to navigate and face, that it is a huge change in your entire life, and that may mean changes in your lifestyle and your habits and the people that you keep around you. So one of the biggest things that I would tell people is to never be afraid to be an advocate for your own mental health. If there's anything that your friends, your family, or your workplace, the place where you go to school, if there's anything that's happening that is affecting your mental health, I really push everybody to speak up and make sure that you are seen and that you are cared for in the ways that you want to be cared for. And that is one way in which we can contribute to our mental health and then to the community's mental health.
Yeah. I wanted to jump in and ask the question about COVID because with COVID emerging and, we were hit in a major kind of way where people's mental was actually challenged in ways that have not been seen in many years. Talk to me about the experience that you've had by way of increased clientele and maybe some of the services that are needed coming out of COVID.
Yep. As a service provider, what I realize is that a lot of people need workforce development training, career training. A lot of people are wanting to change career lanes, but not knowing how to navigate that. So I think that's one of the main things, that if people have access to work that is that fulfills their passions and in which they get paid fairly and adequately, that's one big step to achieving some of the mental health barriers, right? Because we know that some of it comes from lack of resources. And then another thing that I feel the community needs is definitely more access to one-on-one therapy and also group therapy, family therapy, couples therapy, and all of that. A lot of the people who I've seen that were able to do that either had insurance or had the means to pay for that. So I think that's something that the city should be looking at. And then the other thing is that lack of healthcare doesn't just affect one individual's mental health. It actually affects the community, because the lack of access to healthcare is the reason why COVID was so rampant in certain communities. So we have to address the big elephant in the room, which is the lack of equity that there is when it comes to healthcare in this city and in this country. So I attribute, all of those things are factors. The way that the community is, how accepting we are of one another, all of those things are all factors.
No, you bring good insight there. Where should people go to get more information?
For XL Wellness, you can go to xlwell.com. That's our website. And if you want more information about NYC Well or any of the other services in the city, feel free to call 311. They're always happy to direct people with the exact phone numbers and all that good stuff.
Well, I want to tell you, Marielle, it's been great talking to you. I think it's an important conversation that we have to continue to have. And so many people, as I was saying in another segment, don't always seek therapy because it's not too common and it's not too accepted a practice in communities of color. But we are seeing more and more people begin to reach out. And I'm glad that you're out there to be a lifeline to so many people. So thank you.
Thank you so much, Darren.
All
Thank you
righty.
again for having me.
All right. Well, listen, I want viewers to know if you want more information, guess what? Visit her website at xlwell.com and then also follow them on social media at XL Wellness.